Will technology propel us into a new era of healthcare? Last week, we spoke with Dr. Marshall Runge about the evolution of America's healthcare system. Runge is the Dean of the University of Michigan Medical School, CEO of Michigan Medicine, and author of his new book, The Great Healthcare Disruption. He mentioned how AI is changing the game for physicians and patients alike, but says that the evolution of our health system isn't just about new technology. We first need to be responsible for our own daily health. It's a concept he says needs to be introduced to the public as early as possible.
For young people, particularly elementary school and middle school, their brains are a sponge. And if we can help educate people, and sometimes it's a doctor or a healthcare provider, sometimes it's somebody that they would recognize, an athlete or a poet or whoever, who can help them understand what's important about health. If we can work on health, the United States is going to be a very different place in 10 or 15 years. There are all kinds of statistics on this, but one is looking at something called healthy longevity. It's not just how long you live, but it's how long you live a healthy and productive life. And the United States has fallen behind. We're ranked about 60th in the world, if you can believe it. And by 2050, the estimates are if we don't do something dramatically different, we're going to rank 120th in the world.
There is a list that America is the clear leader in, but it's not exactly something to be proud of. The U.S. spends more per person on healthcare than any other country. In fact, the Peterson KFF Health System Tracker reports that other large wealthy countries spend about half as much per person. Usually, the idea behind expensive innovation is that there will be a short-term rise in cost, but it saves money in the long run due to increases in efficiency. But if the U.S. has been upholding this idea for years, why are we still paying so much more than any other country? Runge thinks the broken piece is that we're not funneling that innovation into preventive medicine. Instead, we see a lot of evolution with the really expensive, complicated medical procedures needed for serious or chronic conditions.
Well, the problem is that we're not taking known approaches that are much less expensive, much earlier in the course. So I'll give you one popular example these days. That's these obesity drugs, also called GLP-1 agonists. Those drugs are highly effective for obesity. What people don't think about is they weren't developed for obesity. They were developed for diabetes. And they're outstanding in treating all aspects of diabetes and reducing the risk of the complications of diabetes, like ocular eye problems, heart problems, and renal failure. There's just a long list of those, all of which are difficult to treat.
But by getting their condition under control before it causes all of these other issues, we can drastically reduce healthcare costs down the line. Runge says we already have the tools to prevent a lot of these chronic conditions. We just need to utilize them much earlier in a patient's health journey. However, changing the main focus of healthcare is going to have drastic effects on the financial side of the industry. America generally operates under a fee-for-service structure, where surgeries and similar specialties are where most of the money is made. Runge says that in order to evolve into a healthier society, we're going to have to rethink these reimbursement models.
I'm in charge of a big health system. Our budget is almost $9 billion a year. So if I say, okay, we're not going to do any more of these procedures, that has profound impact on our health system and the 50,000 employees we have. We can't pay their salaries. And so, I feel like now, toward the end of my career, I have an epiphany that, hey, we shouldn't be doing that. But on the other hand, my job is to be sure that we have a bottom line. So how have different countries addressed this? Again, I think they've addressed it by providing a base level of healthcare. It's very health-oriented. It's procedures that make a lot of money that keep hospitals afloat. And I think that there is intense scrutiny on that from all political parties. And it's something we have to address, and I think it's only going to be addressed by changing reimbursement models.
It can't happen overnight, but Runge believes it's a foundational part of truly creating change within our healthcare system to become a healthier country.
It could easily take 10 years. But I think we have to make some of these changes today, and those will be very disruptive, but we have to do that to try to, at the end of the day, all of us who went into healthcare initially, we're thinking about patients. We need to keep thinking the patient should be the center of our world, not our lifestyle, not the profitability of our system. It's got to be, what can we do that's good for the patient? And I think if we can take a step back, and that applies not just to healthcare providers, That certainly applies to those who pay for healthcare, insurance companies, Medicare, Medicaid, government funders, et cetera.
So instead of the pay-to-play model we currently have, Runge wants to shift the reimbursement structure to favor preventive medicine and primary care.
It doesn't have to decrease in reimbursement for the specialists. They shouldn't increase, or maybe they don't increase nearly as quickly, but that it's an immediate increase in recognition, financial recognition for what the providers do who are keeping people healthy. And then that slows down the trickle of people coming in to need more advanced healthcare.
But if it's no longer a fee-for-service system, where does the extra money come from to draw doctors back into primary care? Runge says this is where the government needs to step in and treat the funding as an investment in the country's long-term health.
And if you think about it, what does the government do? It builds roads. There's no one-year payback on building roads. There's no one-year payback on making sure the water supply is available and pristinely clear so people don't get infected from the water supply. All the things that government does sort of provides our infrastructure are long-term investments. That's totally different than commercial insurance and other kinds of insurance who have stockholders they have to report to. And every quarter or every year, their books are looked at. And so it's not a surprise to me that insurance companies don't want to pay for the GLP-1 agonists, the weight loss drugs, because that benefit isn't going to be seen for years. So I think it's got to be some combination of what are the kinds of things we need to do that have a long-term positive impact, and to recognize that the way that our healthcare payers are structured, that just doesn't work for them. And so that either means they have to change or that we have to provide another way to pay for that long-term benefit of health.
And again, as we demand more from healthcare, we need to demand more from ourselves to build a solid foundation of health in our own lives. It's not always easy to get in a workout or eat the more nutritious option, but it's the best decision you can make for your physical and financial health.
You have to make some sacrifices, and I think the sacrifices are there, and mostly they're ones that will not compromise health at all. In fact, they should improve health. And we can live healthier and we can have great health care, and we can prevent future generations from having to mop up for the mess that we made during the last 25 years. But we need to get started on it now.
Runge's book, The Great Healthcare Disruption, is available now wherever books are sold. You can find more information about Dr. Marshall Runge and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.